I think when it comes to health, we have basically looked at it from an infrastructure point of view, which means increase the bed capacity, increase our theaters and so on. And in all our sub-counties, we have been able to put up a level 4 hospital. It's only in Subukia and Rongai that we are starting in the coming financial year. But in all these others, we have already started something. It's also important to note that we have introduced some services that were previously not there, including oncology, which was really a big challenge for people who had to travel for cancer treatment in Nairobi. On the issue of personnel, we have also looked for specialists so that some of those conditions that would require that we refer patients to far and wide are also addressed within reach. So I think as we move forward, there is a major transformation within the health subsector, and I think we now want to invest in more equipment, more diagnostic equipment, and more speciality sort of approach. In partnership with the national government, we're also coming up with a mental hospital in Gilgil, because we also know that this is one of the areas that has been largely ignored, and one that we need to also work around with. So I guess that's where we are for now, and our emergency response. We are on the major highway, on the corridor, and because of that, there are major traffic. Sometimes we have accidents and all that, so we would want to also upgrade our emergency response capabilities to ensure that whatever emergency comes, we can be able to deal with it. And I think this goes a long way in terms of also reducing the risk. Every city has a risk factor, and the degree to which you can respond to emergency contributes to that significantly. We have also adopted a preventive sort of approach, so we are investing in what you call community health workers, people at the very grassroots level who know this is Jane and this is Peter, and they can be able to advise them on their dietary and other sort of issues. So we are dealing with it also from a micro level and also at a very basic